I'm Gaston Dajishmana, and as I said before, a Rwanda medical student, and I'll be your moderator for today's session. So I'm really excited to be with you guys for this powerful conversation about mental health and sexual reproductive health. So, and exploring how are these two concepts are connected. So let's see then. Perfect. So we can get now start. Yeah.
Yeah.
So hi. So keep sharing in the chat box, and remember we are going to have this conversation. It's going to be around mental health and sexual reproductive health. So and exploring how exactly these two concepts are so much related. So as you might know, a lot of things they happen to ourselves, to our bodies, specifically as we turn around 10 to 12 years, and that's for girls, and for boys around 11 to 13. As we are getting ourselves, our reproductive health so much developed, so that we become women and others become men. Okay, so in that kind of things, so much hormones they kicks in, and the body starts changing, and it's really a lot to our body, both physically and emotionally. So why these changes completely and normal, they are part of our growing. Okay, they can also come with a lot of stress, confusions, emotion ups and down, especially if young people do not have right information and they are not really informed how to navigate from those things. So, in fact, a lot of research shows that when we don't talk openly or educate well around these topics, they can lead to different things, both psychologically and physically. But we mostly explore what are they then in mentally? I mean, that is psychologically. So a lot of researches can shows that these things can lead to different complications like anxiety, depression, and health choices, and among many of them. So that's why then this discussion is so much important. So we are going to see exactly the deep connection between mental health and sexual reproductive health, with support of our passionate and knowledgeable voices to help us understand how these two concepts related. So I would like then to introduce our beautiful speakers, Dr. Helen Kiholo from Kenya. She's a past WMI Global Advisor Board member, and she's also a medical doctor by profession. And she's currently pursuing her residence program in general surgery. And more than that, she's very passionate about human rights and compassion work. So we have also Phoebe Msonda from Zambia, who is currently also serving as WMI regional coordinator for Central and Southern Africa. And she has over 12 years of experience, working with international NGOs, particularly in the field of gender equality and gender-based violence prevention and case management. We will also be honored to have Dr. Onisai from Zimbabwe. She's a medical doctor by professional. She holds master's degree in sexual reproductive health medicine. And more than that, she's deeply passionate about advancing sexual and reproductive health and rights education. We will also be honored to have Joyce Shikuku from Kenya. She's currently serving as WMI coordinator for East Africa region, and she's dedicated and dynamic leader with over 5 years of experience leading different programs across Africa. And she's very passionate about girls and women's health. Yeah. So you are welcome, our beautiful speakers. And to start off, I will be inviting each of our panelists, to reflect on this question. So, starting with the first one, like every panelist will be having around 4 minutes, to share the insight, the beautiful ideas about this question. Particularly, what does mental health and sexual reproductive health mean to you, and how have you seen them or overlap in the real life? So I would like then to welcome Dr. Helen. Are you there? Can you hear me?
Yes, I can hear you. Are you, Gaston?
Yes, please. Over to you.
Okay, thank you so much. I think thank you so much for the nice introduction. And just to dive straight into the question, my understanding of sexual reproductive health and mental health, and pretty much we'll borrow this explanation right from WHO explanation of health, where it is the absence. It's not just the absence of infirmity, but also your psychological, your emotional, your mental, your physical well-being. And these are coming together even in sexual and reproductive health, how it interacts with our mental health today, especially in the aspect of sexual reproductive health today. We are looking at the physical aspect where, can you hear me now? I am sorry. I can add my voice volume just a little higher. Is that better, Joyce? I've seen you commenting about the volume. So, in terms of physical, we are talking about access to contraception, to fertility and infertility care, how you take your care of yourself during pregnancy and during childbirth. In mental health, we are looking at how comfortable and how confident are you in your sexuality, and how does that influence your choices. And socially, do you have the support system that entails you being yourself in your sexuality? And this also even comes in the light of the world as it is now, where we are dealing with even the LGBTQ community, and their health also comes in the same. So it's not just for heterosexuals, it's also even for all the other lines of people. And for everyone, health is paramount. That's my take. Thank you, Gaston. Over to you, Gaston. Am I audible?
Yes, you're
Yes, Helen,
audible.
you are.
Okay, then I tap the next panelist, Onesai.
Okay, thank you, Helen. So I could just go through. So I just want people to see my face for a bit.
Yes, please.
If I keep my video on for a while, it might cause some network challenges. So just to say hi, everybody, this is the face behind Dr. Onesai. And I will speak to how closely to the question that has been raised. So, mental and sexual reproductive health are actually deeply interconnected, and they influence each other in complex ways. So, sometimes there's that psychological impact of sexual and reproductive health issues. So, these can be unintended pregnancy, wherein someone then goes through anxiety, depression, or trauma from an unplanned pregnancy. And this is especially so in cases of limited support or cohesion. And then there's also the issue of infertility that Dr. Helen talked about, where struggles with infertility can actually lead to grief, low self-esteem, as well as depression. And there's also the issue around sexually transmitted infections, where diagnosis of HIV or other sexually transmitted infections may trigger stress, shame, or fear of stigma. And then there's also abortion or miscarriage, where there's that post abortion or post miscarriage emotional distress. This is not universal, but it can occur, particularly where access to post-abortal care is restricted or stigmatized. So there's also people with mental health conditions, and this then affects sexual and reproductive health. So you've got people with depression, which may lead to low libido. So it may reduce sexual desire or functioning. And then there are also people with impulsive behaviors who have got conditions like bipolar affective disorder. And this may lead to risky sexual behaviors. For example, they may engage in unprotected sex, they may have multiple partners. And then there's also the concept of medication side effects, where some antidepressants or antipsychotics can actually affect sexual performance or fertility. And then there's also the issue around trauma and sexual health. So if you've had past trauma, for example, you've been sexually abused or assaulted, it can severely impact both your mental and reproductive health. So survivors of sexual abuse or trauma or assault may struggle with intimacy, they may struggle with arousal, or even have chronic pain during sex, because sometimes it's sometimes so sex really begins in the brain. So once you've got something that's affecting you, you've got anxiety, you've got depression, you've got that trauma, it may then cause you to actually have pain whilst you're having sex. You may also struggle with being intimate or just being affectionate with your partner. And then there's also higher risk of re-victimization, where because of these mental health struggles, some individuals may then be more vulnerable to exploitation. And then there's also, the marginalized groups, which then give rise to stigma and discrimination. You've got people with HIV, sex workers, and then these people actually often face discrimination that harms both their mental health and sexual and reproductive health. They've got internalized shame, they are denied sexual and reproductive health education, and they may experience isolation or depression. And then there's also barriers to care, where fear of judgment may prevent someone from actually seeking contraception or sexually transmitted infection testing. So because of this strong link, holistic approaches then become essential. Thank you. Back to you, Gaston, or I'll pass on the baton to Phoebe.
Okay, thank you so much, Dr. Onesai. You've mentioned some of the things I wanted to talk about, but I will also just reiterate some of the things and maybe speak a little bit from experience in terms of some of the issues that I have witnessed working on, especially SGBV, that's sexual related gender-based violence. So like everyone else has said, you cannot speak about sexual reproductive health and mental health separately. So these two are very interlinked, as the previous two speakers have talked about. So for me, I'll mostly focus, because the two doctors have talked about the medical side effects. I'll speak about how this affects someone socially, but also some of the legal challenges that we've faced, especially when you are looking at SGBV. So SGBV, I'll be using the abbreviation that's for sexual related gender-based violence. So like the two doctors have said, so sexual abuse or the violation of someone's body sexually may lead to prolonged mental health issues, with some of which have been mentioned. But from my experience, one of the things that we've noticed is that when you're looking at most of the cases of SGBV would be those. So when you're talking about SGBV, I think universally they are categorized in two ways. So those are rape, which is sexual abuse of adults, And then there's also, in Zambia, we call it defilement, but it's just rape of a minor, rape of a child. But most of when you look at the statistics, you'll see that most of 1 in 3 women have been raped. So if there are 3 women at any given time, 1 of those women have been sexually abused, and then somewhere to 1 in 5 were abused as a child. So when you look at those statistics, those are alarming. They shouldn't even be. We should be talking about zero cases. But when you're looking at survivors of sexual violence and how that affects them, first of all, legally, when rape happens, it's very hard to prosecute in terms of taking the matter to court, because first of all, there is a lot of re-traumatizing when it occurs. Most people do not re-traumatizing, sorry. Most people do not know how to handle cases of rape. So, for example, when we're doing community sensitization, we're talking to, first of all, within the communities, it's a taboo to talk about these sexual issues. It's also a cultural taboo, but also religiously and whatnot. So most people would not even report these cases under normal circumstances. And even when they report the cases, you find that the service providers, we call them service providers, so those who are tasked, like healthcare, the police, lawyers and whatnot, the police do not know how to handle these cases. But now I think there's a lot of education around that. But even with that, you find that most people do not know how to handle anyone who's a survivor of sexual violence. So you find that just from the way the systems have been set up, they are not set up to protect survivors of sexual violence. That means also when you're talking about mental health, you find that people prefer not to report those cases, thereby keeping that inside. Keeping that within, whether it happens in the family, they'll say we shouldn't tell anyone else because it will bring shame to the family. So the survivor is not centered. The person who's centered is the perpetrator. So you find that now that becomes a cycle, the cycle that Dr. Onesai talked about, re-victimization, or you find that the person who was a victim becomes a perpetrator because that is a norm amongst maybe where you're coming from in the community or within the family. So all in all, when you're talking about sexual abuse and mental health, it should be taken with care, but it should also be talked about. I feel as people who've attended these webinars, people who are working within communities, because WMI is made up of community workers, can we be ambassadors of people who are looking out for survivors of sexual violence and speaking out? Because this, if it's not talked about, it's something that is an ongoing cycle. So I think that's what I would talk about. I would pass it on to Joyce. Thank you.
Thank you so much, Phoebe, and hi, everyone. I would also like to build onto what Phoebe has said. I would like to measure it or just focus maybe on real life situations. Me being a person who works with adolescent girls and young women, and conducted several studies on why so many young girls are engaged in sexual debut at a very young age. We came to realize that at least 80% of the girls that we interviewed had engaged in sexual debut at the age of 11 to 15. And by the time they were 15, they had at least 3 or 2 children. And out of the 20%, we wanted to find out why didn't you engage in sexual debut until you were past 18 years? And the reason we got was because their parents sat them down and talked to them about sex and its effect, hence they retained the teachings from their parents. This is something that is not done in most of our cultural setups. We disregard sexual education. We call it taboo, quote unquote, because we are not free to talk to our young girls or young boys about sex. We feel like if we talk to them about sex, it's when we'll actually have told them go and engage in sexual activities. But that's not the norm. It's actually trying to give them information that they need before. Now, when they're engaging in sexual activities, they know I have made a choice and I know the consequences, then I'm doing it for my own, with my own, at my own likes or pleasure. So now, when these young girls, now that they do not have any knowledge about sexual activities or sexual reproduction, they are taught by the world or they are taught by their peers. And when you come to these rural setups, most of the young girls who've actually had sex at a very young age, they become the teachers of the others. So this person who wants to try, they'll seek advice from the person who has experience, and then they'll lure them because I have experience and I have already broken all the norms and I'm already ashamed and everything. I'll also want somebody else to come and do it like I did so that we can all be in the same WhatsApp group. So I need somebody who is going to bear the shame along with me. So most of the young girls or young boys engage in sexual relations at a very young age. For the boys, most of them are engaged in sexual activities by their caretakers. These are the house helps who we've invited to our house to take care of our young boys. They start introducing them to sex at a very, very young age. If you sit down with these boys, they'll tell you these examples. So they are dragged into sexual intercourse because of maybe peer influence, and then that one, this is a case of defilement, but most of the people will not report that my child was defiled by my house help. As Phoebe has said, they'll want to settle it as a family. They wouldn't want it to go beyond the family case. So they wouldn't want to report it anywhere else. And these young girls, they're involved in these activities because they cannot negotiate for sex. So whatever comes they're just there. They don't know how to say no. They cannot say, I want to have safe sex. They cannot say all that. So they're just dragged into all these activities. And once they have messed up, that's when the reality dawns. They start feeling guilty, they start feeling shameful, they feel like they've disappointed their families, and it might affect them psychologically, and it might go to maybe Onesai and Helen have spoken about post-traumatic stress disorder, they talked about depression, and these things can go all along, all the way to somebody feeling so guilty to a point of committing suicide. So as all the ladies have all said that mental health or sexual reproductive health, they go hand in hand with mental health and they're not separable. Thank you, and back to you, moderator.
Perfect. Thank you so much, Joyce, for the beautiful insights. If you could please allow me to go back to Phoebe. Like Phoebe, if you can hear me now.
Yes, I can.
Thank you. So Phoebe, how do you think gender norms and personal expectations experience like we have are being now influenced like with the gender norms and expectations, and like they influence the way we experience mental health, and what roles do they play in gender-based violence?
Okay, thank you so much. So I think I would start by, most of the times we use gender and sex interchangeably when we're talking about it, but I wanted to just make a clear definition of what gender is. So gender usually it's a social construct. So what is gender most of the times is not universal, because as we are in society, we there are different things that influence how society define things. So there are religion, there are cultures, there's also any other social thing that can influence the definition of gender. So gender refers to a socially constructed roles and behaviors, expressions, and identities of girls, women, boys, and men. So over the past few years, the word gender has had a spectrum, but we'll focus on the binary for now, where it's male and female. So when I say it's not universal, I mean that sometimes what is considered a male role in Zambia might not be considered a male role in Uganda, or may not be considered a male role in another country. For example, when you're talking about another controversial thing, which is feminism, people the white people would, the feminism from the white people is a bit different from the Zambian one. I'll talk about the Zambian one, but most of the African, because most of our culture is matrilineal rather than patriarchal. So, for example, women are revered or they are respected in our culture because of what they carry and whatnot. So that gender norm might not be something that is universal. But then coming back to your question, when we talk about how these are interrelated to sexual reproductive health and mental health, I'll talk about the fact that the society will look at what a strong, like there should be a strong man versus an emotional woman. So what that does to mental health is that men are expected to be strong all the time. For example, in my family, I think I've only witnessed men in my family cry at very on occasion. They're not emotional human beings. So maybe if maybe when my grandma passed away, that's when I saw my uncles cry for the first time, because the society has said a man should not cry anyhow, and women are expected to be emotional. So therefore, women are not leaders. That's what they say, because you're too emotional, which is an argument you can say, okay, so if women are emotional and can't be leaders, how come most wars are started by men? But then when we come back to mental health, you're saying that because men are expected to be strong, which means they can't talk about things that affect them emotionally without being laughed at. So if they are victims of any form of abuse, whether in society or within their homes, they can't report that. And then when you're talking about the patriarchal gender norms, where men are empowered to say they are more sexual than women, you find that consent, therefore, is taken out of the picture. So they feel like they are entitled to women's bodies. Therefore, that's why you find that there's a rape culture that is perpetrated, because men are not held accountable because they are supposed to be sexual beings and they are not respectful. So that's the harm that comes with these gender norms, where the society is not looking at human beings as human beings. We are looking at it from the lens of Gaston should act a certain way, Phoebe should act a certain way. Therefore, when Gaston acts like the way Phoebe is supposed to be acting, therefore Gaston is not man enough. So therefore, these are there's no room for you as Gaston to report when you have a mental health issue, when you're suffering from depression, when when a male is sexually assaulted. When you're talking about defilement, especially from the Zambian context, you find that most of the times they're talking about protect the girl child rather than what about the boy child, because they're equally helpless. So all in all, mental health affects human beings, not men and women, but it affects human beings. But because we've taken a gender lens to it, we find that sometimes men are neglected when we're talking about mental health. They're just expected to be strong. So therefore, you find there are more suicidal cases amongst men than they are amongst women. And there are more sexual violence cases amongst women rather than amongst men, because there's that power dynamic as well. So when we're speaking about gender, I think we need to really go into details rather than use it to, most of the times when we're talking about gender issues, people will talk about something that will advantage them rather than instead of coming in a neutral way. So that's what I would say about gender norms and mental health and sexual reproductive health. Thank you.
Yeah, thank you so much, Phoebe, for that beautiful insight. Going then to Ellen, if you can hear me.
Yes, I can hear you.
Yes, please. So Phoebe has mentioned something very important, challenging, these kinds of taboos that we have in a community, that, men are not considering themselves as, emotional human beings. So, and we have a lot of taboos and, some concept around that. So, Ellen, why do you think is the sexual reproductive health and mental health in general still considered like taboo topics? And what are some common misunderstandings that uh, we have around these topics, and what does a safe conversation around these topics, mental health and sexual reproductive health, would look like to you?
Okay, thank you for the question. Jumping straight on, one is that there is a tendency to believe that we believe that the two are unrelated: sexual, reproductive health, and mental health. While I was going through this in the introduction, I mentioned that these are all encompassed even in the definition of health. And by that in itself, it tells us that they are both interrelated. They are not separate domains. For example, a person who had an unwanted pregnancy can go into depression and anxiety just because of that one experience. A person who has issues with like polycystic ovarian syndrome, menopause, some hormonal imbalances, this can affect even one's mood. When you're looking at mental health issues, they can affect your libido, your ability to make decisions regarding sex, and even things like contraceptive use. Secondly, we assume that mental health issues are always psychological and can never be biological. The psychological world and the psychiatric world is advancing in trying to find out if there are like some genetic components that predispose you to being that predispose you to being affected by mental problems. For example, when we are in school as medical doctors, you always wonder why are you always asking patients and people who come to us, do you have a family history of this? Could it be that this contributes something? The truth is, people think that these problems are just in your head, while in reality, even reproductive hormones affect your affected by your mental health as well. Things like postpartum depression, mood shifts like during contraceptive use, they are true things. Thirdly, we have a lot of stigma around sexual trauma and the psychological effects that come with it. We rarely talk about sexual abuse, assault, and harassment. And even sometimes, even in a working environment, when you go to HR to tell them about these things, especially as a woman, there's not even evidence that this guy came and told me something that's sexually aligned. And depending on who it is, they might be like, but that sounds like something that anyone can say, anyone can do. So it then makes it very hard to hold a conversation around that. The reality is sexual trauma can lead you to PTSD, can lead you to have anxiety, can lead you to be depressed, and especially this is more common even amongst women. And it is important to keep addressing these issues. Fourthly, um, our cultures and our religions are quite silent when it comes to these matters. We don't want to talk about those things, especially when we are seated with our elders, when we are seated with our religious leaders, because it's a taboo topic. Because how are we going to talk about these things in front of our children? They want to hold the conversations amongst themselves. They don't want to talk to it about their children. And yet today here, it's evident that most of what we're looking at is affecting our children and our young ones, the people whom we should be looking at and the people whom we should be modeling our character so that they can emulate. So the reality is the silence usually masks these problems, and you think you're going it through all this alone, whereas there are people out there who are suffering the same way you are. Um, Things like being coerced into marriage, things like lacking access to things like contraception. There's a lot of shame around infertility and menstrual problems, and this can affect your mental well-being as well. Being silent about it does not necessarily make it right. The other thing is our mental health management. I feel like it ignores quite a little bit about sexual reproductive health. When you come with a problem, most of the time we focus on treating it, and sometimes we will give you medication to remedy your mental health problems and not much to remedy your sexual and reproductive health problems, which is probably a failure on our part. But it is important that we continue looking at people holistically and managing them as such. Then even when we're giving our, just mentioned things like contraception can affect your mental health, hormonal imbalances. We rarely screen our women when we are talking to them about these things. We don't tell them, oh, but you suffer from depression. Am I then going to go ahead and give you an estrogen pill, an estrogen only contraception? You know, we are not cognizant, and sometimes we ignore that this can affect your health. Probably even just extrapolating it and looking at men, most of the management that we go ahead, even in management of things like cancer, prostate cancer, is medication that affects then how your libido basically. And sometimes I've seen patients who it's a conversation that they've not had before. They only come back on their return date just to tell you, I've been having issues, and mama now thinks that I'm cheating on her. You have just created a new problem in your hands. So, what does a safe environment look like for me? A safe environment looks like a place where we can hold conversations without shame, without fear, and without being worried that this is my elder. I am talking to my mother about these things. I am talking to my doctor about it. And sometimes I think it's worse even for us young doctors, and especially when we are talking to our old men. They think, what is this child of mine telling me? How is she getting the guts to talk to me about my sexual health? How can she ask me such questions? You see? And it's something that we should break this cycle and encourage such safe conversations. And I usually like, for me, I usually like telling people that once we hold this conversation here, I will probably not remember, especially when it comes to patients, I'll probably not remember who that it was you. When I meet with you on the corridors, I'll not be like, this is the guy that came with infertility. I'll not remember you in that way. I'll remember, probably if I remember you, I'll remember our conversations, but not who it was specifically. So, and this again is also bound by a Hippocratic oath. I'm not about to go about and discuss it with the community just because I'm the person you came and found me and we come from the same village. So, create a safe environment where you can hold conversations about it, and you don't have to keep sharing with other people's problems. Just make sure that they feel safe, that they're able to share with you everything regarding their situation. Thank you.
Thank you
Gaston,
so
would you
much,
like to?
Levin. Yeah, thank you so much for challenging the concept that we still consider taboos, but yet needs to be openly discussed for youth and adolescents to learn more. So allow me to jump to Onisai. Can you hear me?
Yes, I can, Gaston.
Yes, please. So Onisai, what does actually a healthy relationship looks like, and how can partners meet each other's physical, emotional, or the social needs?
Okay. Thank you, Gaston, for that question. So, a healthy relationship is built on mutual respect, trust, communication, and support. This is when partners work together to nurture each other's well being, physically, emotionally, and socially. So, when a relationship is healthy, there is emotional communication and connection, which means that there is open, honest conversations without fear of judgment. There is active listening where you validate each other's feelings. There is a willingness to resolve conflicts constructively. There is no yelling, there are no blame games or silent treatment. And then how to foster it, you need to check in regularly with your partner. Ask them, how are you really feeling? Use I statements. I felt hurt when you did this and that, instead of saying you always. And then also practice empathy. Try to understand your partner's perspective, even during disagreements. And then when when a relationship as well is healthy, there's physical intimacy and safety. There's consensual, satisfying sexual connection. There's affection that's beyond sex. You hold hands, you hug, you cuddle. And there's also respect for boundaries. So there's no pressure to engage in unwanted acts. How you foster it is to discuss needs openly. You ask your partner, what makes you feel loved physically? You prioritize non sexual touch, small gestures, a shoulder rub, a kiss, goodbye. Those things build closeness. And then you also need to address issues early. So if libidos differ or health problems arise, you need to seek solutions together, for example, therapy or medical advice. And there's also a component of social support and independence within a healthy relationship where you encourage each other's friendships and hobbies. You balance couple time with individual space. And there's also no jealousy over platonic relationships. So how you foster it is to avoid isolation. Don't demand all of your partner's time. You need to also support their social life. You must have shared and separate interests, and these help you grow together and as individuals. Then you also need to respect their privacy. Trust matters. No snooping on phones or controlling who they see. And then there's also mutual respect and equality, which I talked about initially as I started off this conversation. To say decisions are made together, where be it financing, be it parenting, be it career moves. There is no belittling, no name calling or manipulation. There is also appreciation for each other's contributions, even small ones. So how you foster it, you say thank you often, acknowledge your partner when they do chores, emotionally support them, share responsibilities. So you need to avoid one partner being overburdened. So for example, you split household tasks fairly. And then you also respect each other's differences. In a relationship, you don't have to agree on everything, but you must respect each other's views. And then under trust and security, there is no constant suspicion or testing of loyalty. Um, it's a relationship where you can rely on each other, you follow through on promises, and then you also feel safe to be vulnerable without fear of betrayal. So, how you can achieve this is you need to be transparent, but not obsessive. So, you share feelings and plans naturally. You keep commitments. If you say you call, do it, because small trust builders matter. And then address insecurities calmly. If trust is broken, you rebuild it through actions, not just words. And then there's also an issue of growth and adaptability, where you support each other's personal goals, career health. These days, people are so into running, walking, going to the gym, self improvement, adapting to life changes, be it parenthood, be it illness, be it relocation as well. And you deal with it as a team, and also willingness to seek help. So when you're stuck, seek therapy, seek counseling. So how do you foster it? You set goals together. For example, where do you see yourselves in 5 years? You learn from conflicts. You view disagreements as opportunities to understand each other better. You also celebrate milestones. So acknowledge progress, whether big or small. Even the small actually matters a lot. When you acknowledge even the small wins, it means so much to the other person. So red flags includes, contempt, control, stonewalling. Stonewalling is when you're just not responding or you're just silent. You don't even say anything when you have an argument. That is a red flag and it's an unhealthy sign. Also, walking on eggshells, in when you're with your partner, you're even scared to say anything lest they become angry. And then healthy or green flags, it's actually laughter, compromise. You feel safe, you feel at home with each other. So my final tip as I round off is that a strong relationship isn't about perfection. It's about effort, it's about repair, and it's about choosing each other daily. So you need to ask your partner regularly, what do you need from me right now? So thank you, Gaston, and back to you.
Thank you so much, Onesai, for the beautiful insights of how the nurse relationship should be looking like. So, as informing our attendees, please be ready with your questions. Just type in them in the chat box. Yeah, and then we will be back with them. So, allow me then to just go. Joyce, can you hear me, please?
Yes, I can hear you, Gaston.
Okay, thank you so much. Joyce, back to you. So, Joyce, what are the mental health and the challenges? The mental health challenges that comes, with unplanned pregnancies and sexual transmitted infections as the most, bad outcomes you would expect from bad decisions, and how can they be addressed?
Okay, so some of the common mental health issues, as Onesai and Phoebe and Helen have spoken about, I wouldn't go much deeper into them because I believe they've spoken about them. I'll just highlight them. We have someone may fall into anxiety and depression. For instance, if somebody had unplanned pregnancy, they'll feel ashamed, not as in they're not sure whether they want to keep it or not, blah blah blah. They worry about the future. How will somebody will take care of my baby? How will this person continue sticking with me? They'll have anxiety or even have depression. For sexual and reproductive health, and as in for sexual transmitted infections, people are afraid of being stigmatized. They're afraid of going to health facilities to get treatment. They may feel guilt and shame. They're worried about health and who transmitted, who did I get this thing from? And then there's this issue of relationship strain. Both issues can create tension to you and your partner, your family, your friends, therefore leading to conflict and isolation, or even gender-based violence, as Phoebe has mentioned it. And then for people living with sexually transmitted infection, maybe for instance, let's say HIV or hepatitis, there may be fears about being perceived or how will people take me. Those are the things. Fear of the unknown actually is what affects them the most. And then they might end up with postpartum depression or adjustment disorders, which might end up eventually into maybe somebody committing suicide. How they can be addressed, maybe through counseling and therapy. When you refer these cases to a psychologist or a psychiatrist, not a psychiatrist, or a psychologist, they might be, or a counselor, they might be able to provide individual therapy or even couples therapy or even group counseling to these young girls or young women or young men for them to understand what is going on and then accept and then moving on. In schools, they can be incorporated in the curriculum. Sexual education can be incorporated in the curriculum and be taught in schools right from the primary age when they start puberty. We have them, yes, we used to have them. Right now, I don't know if they still do provide sexual reproductive health in schools. But if they are taught about these things way back in primary school, they might come a long way in preventing these eventualities from happening. And also, if you can get social support from networks, encouraging support from family, friends, and the community or organization that act the same way, they can help reduce the feeling of isolation and also build resilience among these youths. When it advances now, it's when we involve the medical doctors for integration or intervention now. Integrating mental health support into sexual reproductive health services. This one will help to ensure that individuals can receive a holistic care about sexual reproductive health, sexual transmitted infections, and all that. And now the core thing now is addressing stigma. How does the community accept you when you have engaged in sexual debut? Maybe if you have a child at a very young age, now that you're feeling fear, you're feeling guilty and all that, the community needs to learn how they need to address such issues when they come along. So sensitizing the community about sexual reproductive health and the importance of talking to their children about this can help challenge harmful stereotypes and reduce judgment around these issues. So in general, unplanned pregnancies, sexual reproductive health, what is it? Men's reproductive health, sexual reproductive health affects mental health in general, but they can be integrated into so many aspects and they can be addressed in a smooth way that will avoid all these post-traumatic stress disorder or the negative effects of sexual reproductive health and all that. Back to you, Gaston.
Yes, thank you so much, Joyce, for the brief insights. I remember when we started the webinar, you mentioned something related to parents and how they are so reluctant when it comes to discussing sexual reproductive health. And this really links it with this question I have from Alfredi Quitonda. He asked, what do you advise parents who still prefer not to talk about the sexual health with their children, and how does this affect today's society?
So basically, you cannot change somebody's mindset. When somebody, they are so inclined with their culture and taboos and they cannot get out of it, you cannot change their mindset. But what I know, when you tell someone something new, they might not change immediately, but eventually the knowledge you give them will stick to their mind and they will come to change eventually. I'll give a good example. Right now we are putting on clothes, but our forefathers, they never used to wear clothes. Even when we told them about it, they'll be like, no, this is our culture. But right now, even the forefathers, wherever they are, I'm so sure they're like, and yeah, clothes, it's good to wear clothes. So eventually, these people who do not want to be, they don't want to change, they don't want to embrace change. You'll speak to them today, they will refuse. Tomorrow, they will refuse. But eventually, they will come to understand why you're doing it. You give them real life examples. When they see an example they can relate to, it's easier for them to change. So just continue sensitization, but at the end of it all, you cannot force someone to change. Back to you, Gaston.
Yes, perfect. So I think now we can, go to our long-awaited section for Q&A. So have any question, please, you can raise up or you can text it in the chat box, and you are allowed also to present it here. So let me know if you really have a question, please. You can just raise your hand, or if you're getting trouble raising your hand, you can please text in the chat and we support you. So as then you are waiting for our attendees to ask questions, I think now I can ask like each of our panelists as we wrap up our today's, beautiful session. Like what is exactly advice would you give someone dealing with mental health and challenges or traumas that would come along with, and what kinds of support systems should be available, whether in schools or communities. So I would like each of our panelists to take around 1 minute, having insights on this, sharing with us. Okay, thank you. So shall we start with Phoebe?
Okay. Thank you so much. So for me, I think I would look at it from, I work in the community, so I'll look at it from sensitization in terms of the legal education around sexual gender-based violence, or just SRHR. So what happens when your sexual reproductive health rights have been violated, whether there's been discrimination or you are harassed or the service provider was supposed to provide that service is refusing to provide those services, maybe because you are a married woman and your husband is not with you. So most of the times we infuse the culture with things that are not supposed to be infused with. So for me, I would say in our communities, can we know from our countries, from our communities, can we know what the law says about what our rights are around sexual reproductive health and what violation looks like? What I mean by that is that it helps you know your legal parameters of whether to know whether you've been violated or not. But even if it's not we all work. I believe as a WMI, the WMI community, we work with young people. We work with communities. We also work with survivors of sexual gender-based violence. Can we familiarize ourselves with the law that protects them? For example, how do you advocate? So when you're talking about SGBV or GBV, we're looking at it from the prevention part and from the mitigation, which is response part. So how are you going to prevent it? It's by knowing what the laws and policies say within your communities, within your countries, so that when you witness a violation thereof, you can advocate against it. You can know where to point the client or the community member. Do you know where lawyers are found? Do you know what courts, the law says the courts are supposed to do when that happens? As an individual person who's not a lawyer, how can you also help someone? So my advice to us is that if we're survivors, can we speak up? Like, it's not your fault. Do not be ashamed in speaking up against it. And if you know someone who's been violated sexually, can we learn more about what the law says within your country and within your community, and what services are provided within the community, so that you can accompany that person to those services so that they can access legal services as well as, because usually sexual gender-based violence is holistic. What other services do they need? They need mental health services, they need medical services, other medical services, sorry, they need legal services, but they also need a community of support around them. So that would be my last advice. Like, can we take a more active role in supporting survivors also? Thank you.
Perfect. Thank you so much, Phoebe. I would like to call on Helen. Helen, can you hear me?
Am I audible?
Yes, please.
Can you hear?
Yeah.
Okay, thank you. I'd like probably to draw attention to the fact that we are living in different times. The same way we were brought up, the way we were brought up is not the same way people have been brought up today. When we were growing up, there was no internet, and probably our first interaction with these matters, sexual health and everything, came up very late. While for our children today, I was shocked to find my neighbor's child has a phone at the age of 4 years. And I mean, that is the reality, that these children are accessing the internet and they are able to see things that probably we saw very late. So if we don't initiate these conversations early, they will come back to bite us. I am calling on parents, I am calling on us, even when we get to the parenthood level, that we initiate these conversations early enough. Because if we don't teach them, the world is still teaching them. And ignoring doesn't make the problems go away. It just amplifies them. They will want to experiment. They will want to hear what other people are doing. And if they go out there and these are not, and maybe they face issues out there, and these are not conversations that you had introduced from home, then they will find it very hard to come and explain to you that, Mom, this happened, Dad, this and this happened. If you don't let them know that these things happen, they will find out. Just do your job as a parent. And it will be nice if we also had these conversations even in our schools and in our churches and in our forums, just integrate it in every other level of learning. Thank you.
Thank you, Helen. As I call upon Onsei to keep sharing us with and advices very quickly, I'd like to remind the attendees to please, if you have a question, raise up your hand or you drop it in the chat. So I'd like to call upon Onsei, please.
Thank you, Gaston. So my last tips for somebody dealing with mental health challenges or trauma is it's okay not to be okay. So suppressing your emotions or pretending to be fine can actually delay healing. Acknowledging pain, is a courageous step. So in terms of the healthcare facility-based support, there are school counselors or on-site psychologists. They can provide confidential support for those that are struggling with mental health issues or trauma. There is also mobile mental health clinics in underserved areas, depending on the country where you live. And then there are also referral pathways to hospitals or specialists, for serious cases. And then there are also hotlines or emergency mental health services that people can get access to for help. Joyce talked about community-based support before, as well as religious and spiritual support. So your leaders, your pastors from church, they can provide emotional and spiritual guidance. And there are also faith-based support groups. So somebody can then access those services that support, that help to deal with their mental health challenges. Thank you, Gaston, and back to you.
Thank you so much, Ellen. I would like to say, I would like then to call upon Joyce, to give us, some advices they could give to someone dealing with mental health challenges. Joyce, can you hear me?
Yes, I can hear you, Gaston. So as my other panelists have said, any person who's dealing with mental health challenges, it's highly recommended that these people seek psychological counseling and a follow-up be done, maybe at least 10 sessions for them to accept what is happening to them and then moving on. Otherwise, family support also, they need to be put very closely with their families. They don't need to be stigmatized because it will make the therapy won't be effective if you're going to see a therapist and then your family is sidelining you. It wouldn't be effective. So they need to have family support. And then also to the extent of the community, if the community can also embrace them and understand that these people are going through mental health and also support them, it will go hand in hand and they're going to heal very quickly. Back to you, Gaston.
Thank you so much, Joyce. I would like to jump into the chat questions. Jean Masebo asked, what's the best approach when talking to these children about sex, and where do we start from for them to understand? Yeah. So any of our speaker comfortable taking this question would please go on.
I'll go because I deal a lot with young girls adolescent girls and young women. So what I do, I normally call for workshops. I invite young girls who are within a certain age bracket, and I conduct a whole day workshop. So I invite people from partners from different organizations who also deal with menstrual health hygiene management. And we provide them with sexual reproductive health education, sex education. We even talk to them about the importance of reporting and any when you feel like you've been touched inappropriately. The lines, child protection services, we provide so that they can be able to contact them freely. And then if there's anyone who needs, we also provide sanitary pads, because most of them, the reason why they engage in sexual debut at a very young age is because they are lured by money to buy sanitary pads. So we provide sanitary pads, and then if we see anybody who has who needs follow up, we pick up their numbers, and then we make a follow up with them for a while until we notice that they're stable. That's when we let them go. That's it. Thank you, Gaston.
Thank you so much, Joyce. We can see we have another question from Alfredi. Very quickly, we are running out of time. I would like to ask our panelists to, please be quickly while answering the questions. So this question from Alfredi asked, like, how can you manage a child who is dealing with adverse childhood experiences, disorders, who grow raised by her aunt, rejected and neglected by both parents as a result of unintended pregnancy. So anyone, please.
I can attempt to respond to that, Gaston. My advice would be, one of the beauty about growing in Africa, I can confidently say Africa, because I have talked to many, or I have interacted with many African people, and it's something that we have in common, is that there's a sense of community. So whether you're living in the city or in the village, there's a sense of community. But my advice would be, you need to, if that person, you don't know the young girl very well, maybe get to know their story, get to know their family background, find out if there's anyone within the family who's able to support them from where they are. But also, what helps is asking when survivors are centered, or when people who've experienced these issues are centered. So don't create solutions for them. Ask them what they would want. You only suggest solutions for them if they are unsure. Then you can say, this is a way you can. These are some of the solutions. For example, ask them, do they want to go back to school? What does that look like? I don't know which country this is, but for an example I'd give is that in Zambia we have what you call under the Education Act, there was something that we advocated for, which is called the re-entry policy. What this means is that the law says that when a girl child gets pregnant, after they give birth, they are supposed to be reintegrated back into school. So education is free of charge from primary up to high school. The only time you pay for education is in college. So I don't know which country the participant is from, but also investigate what are the policies around re-entry policy. Can the girl go back to school? What are some of the organizations, CBOs, NGOs and CBOs within that community that can take in that girl? Because sometimes when these girls fall pregnant or there's an intended pregnancy, it feels like it's the end of the world, but it isn't. It's just one mistake that shouldn't define someone's life. So investigate some more. If you really want to help this person, talk to them, and then also look at the solutions around. Ask them if they have the solutions for them. If they don't want to go back to school, what are some of the economic empowerment programs that are within the community. And if there are no such programs, you're a WMI scholar, talk to Bonnie Mac, the CDG. You can start one within your community to support these, some of these cases. So that's just one way you could help this young lady. Thank you.
Yeah, thank you so much to you all. So I think as we come close to our beautiful session today, we won't be able to take any more questions. Like we are now 15 minutes past the time expected to close. But in the meantime, anyone with a question would like to ask, you could please reach out to any of our GAB members. We would really have to connect with our beautiful speakers. So as we come to close then, I wanted to thank all of you, and a special thanks to our panelists who shared the beautiful insights, and to our amazing attendees for joining us, sharing ideas, asking questions. That was really so much helpful. So today's session, I would like to say it reminded us that sexual reproductive health and mental health are not separate things. So they influence each other even deeply. So when we create spaces for people to talk, we began to heal, to grow, even that creates more room to support each other. That's how I would say, like, mental health as a medical student, future medical doctor, that's the only way that we support any problem that comes along with mental health. It's creating a safe space for people to express the problems they have. So let's then, as attendees who participated here, I expect you learn a lot. You now able to give any support to a person with mental health, or even notice that this is a problem, I would direct. Okay. So I would like then to say thank you, thank you. I would like to see you guys for the next time. Yeah.
Thank you and goodbye.
Thank you, guys.
Bye-bye. Bye-bye, everyone.
Bye-bye.
Thank you. Bye.